Well, let's continue looking at cancer with a focus on access to cancer diagnosis and treatment in Africa. We're now joined by an independent global health consultant, Dr. Allan Pamba, who's joining us from Nairobi, Kenya. Dr. Pamba, appreciate your time this afternoon. Now, can you explain the current state of cancer on the continent and how it compares to other regions of the world?
Really sad, to be honest. You know, we are diagnosing 1 million cases a year. We are losing 700,000 people every year to this disease. And in the next 20 years, those numbers are going to double. Now, Africa is going to be the continent in the world with the fastest rise of cancers or new cases of cancers being reported. So the road ahead looks really tough. We have to act and start acting now. The challenge we see is a lot of our patients are presenting late, and they're presenting late because most people are not aware of cancer or their risk of cancer, and they therefore live with the disease for very long, including those cancers that we can prevent with screening options that are available today.
Now, talk to us about some of the other unique challenges that face African communities outside of what you've talked about late diagnosis as being one of them. Are there any other issues that are specific to the African continent?
Well, we know that our healthcare systems are not as robust as we would like them to be. You know, African governments made a resolution to put 15% of GDP on healthcare investment many years ago. It's never happened. It's only a handful of countries who are doing it. If you don't invest in health, then nothing will change. And yet we can see that the disease patterns in Africa are changing. We've dealt with malaria, TB, and HIV for many years. We're beginning to get a handle on those, not completely out of the woods, we're beginning to get a handle on them. But because of emerging development, new cities, new lifestyles, the threat of the so-called non-communicable diseases, including cancer, so, you know, chronic lung disease, cancer, diseases of the heart and blood, etc., diabetes, etc., are increasing. Our healthcare systems are not set up to deal with this. Today in Africa, we have one pathologist for every 1 million people.
Wow.
We will never be able to diagnose all the cancer we are seeing with that small number of pathologists. So it's the problem is very fundamental. It's back to health systems and how we strengthen our health systems to be able to deal with where we're going.
Now, we really can't have many of these conversations without talking about COVID-19 and how it's impacted access to cancer treatment and obviously support services on the continent.
That's very true. So when COVID happened, as you saw, not just in Africa, but globally, attention shifted to that, you know, pandemic, which was obviously viewed as a massive threat to health. Now, thankfully, in Africa, it didn't, you know, impact us as badly as had been predicted. And, you know, that's a discussion for another day. But what it did do is it directed attention and resources from, you know, routine healthcare to this pandemic, which came and went. It, however, was also a reminder that we need resilient health systems for every day, you know, whether it's to deal with the diseases we have every day or pandemics like those when they happen.
Well, I suppose the million-dollar question really is, how do you prioritize certain issues? I mean, you've just talked about how African governments a few years ago pledged to set aside 15% of their GDPs for health issues. Now, only recently there was the food seminar that took place, and President Macky Sall was talking about placing 10% of economy's GDPs to focus on agriculture. How do we strike that balance between all the demands that countries have and what they need to look out for in the health sector, and specifically cancer?
Let me tell you, Hugo, I think the most important investment a country can make is in people. The biggest asset that Africa has is not the mineral wealth that we all talk about, and that drives a lot more investment in infrastructure. The biggest asset Africa has is you and me, is us, the people of the continent. Now, there are three key areas of investment that could reflect that: health, education, and agriculture. You invest in those, you're investing in your human capital. You know, we have a huge demographic dividend in this continent, 1.4 billion people, with an average age of 20 years. It's the envy of Europe. It's the envy of the US. It's the envy of Japan, you know. But we don't invest in our people. There's this short-termism or thinking that massive infrastructure investments is what will get us into development. It will help, and it is required. But to your point, that balance needs to be right. Let's not leave people behind as we put money in areas that will give us development, but at a much slower pace. So with that understanding, governments should begin to look at their budgets differently and invest in our human capital. And when we do that, then we begin to grow populations that are healthy, that are educated, that are global, and can work anywhere in this world. We have very many very well-trained pathologists, but they're not here. They have gone elsewhere. We have a lot of a brain drain leaving the continent and moving out. And so we need to just rethink how we make our investments and prioritize health, in those conversations.
Well, Dr. Pamba, I'd imagine that you are having a number of conversations with various leaders in government. How are those conversations coming across? I mean, are you able to put the point across? Is it well received? And as much as how much money needs to go into looking after the health, the well-being of Africans?
Yeah, it's when I talk to government officials who are in those positions of responsibility, they ask me the very question you asked me, how do I prioritize? There's so many competing priorities. And I give a view, which I've shared here. They're politicians, they have constituencies to please. And unfortunately, there's a lot of short-term thinking that drives how we make our investment decisions. And these thinkings often cycle around, political election cycles. It's a 5-year horizon, maximum a 7-year horizon, if you're lucky. The things I'm talking about, you need a 20-year horizon, and you transform your health, the health system of your country. Africa today is looking at, as I said, 1 million cases of cancer. In the next 20 years, it's going to be 2 million cases diagnosed every year. I'm not seeing too much movement in terms of policies that governments need to be putting in place that then create an ecosystem where stakeholders, the various stakeholders, can play maximally to transform the cancer care space. We're going to need diagnostics. We're going to need treatments. And in the space of diagnostics, there's a lot. We're really far behind the rest of the world. And yet patients are presenting late with cancers that have technologies that can diagnose them early and save those patients the agony of an early death. And of course, the families, downward impact of that. All of this requires very sound policies stewarded by government with a long-term view on building our human capital.
Well, let's talk about some of those cancers that particularly impact Africa. Is cervical cancer one of them? Breast cancer, we continually talk about that.
Indeed, those are some of the commonest cancers in the continent. And if you look at them, we have interventions that can really reduce them. Breast, cervical, prostate, liver cancer. Some of them even have vaccines. So, in the case of cervical cancer, vaccinations are available to protect young girls from HPV infection, young girls and boys, which downstream will reduce, the number of girls who end up developing cervical cancer. And we also have very simple technologies for screening for breast and cervical cancer, literally applicable anywhere within our public health systems that just need scaling. And through that, we are able to reduce the incidence of these cancers. What I'm seeing in Africa today is a lot of small initiatives that are emerging, driven by NGOs, especially local NGOs, as the way to get government policies to catch up. And again, I see private sector such as Roche partnering with these initiatives to start something, which hopefully one day will be brought to scale. There's one really cool example in Kenya. We're calling it the Empower Clinics, which Roche partners with the Africa Cancer Foundation. And I really like it because it's simple. It's driven by this amazing lady called Dorothy Nyomo, who is very passionate about prevention of cervical cancer. And she sets up the foundation. She looks for, partners, including Roche. They have 17 Empower clinics across Kenya and growing. And what they do is they have integrated these clinics with women's care within the public health system. So a woman going to deliver or get care in public systems is offered screening for breast and cervical cancer while she's getting her care. So it's all seamless. In the last 2 years, they have screened about 25,000 women, and you can only imagine the number of cancers that have been prevented. Indeed, we are seeing in the areas where these Empower clinics are available, a reduction in late-stage presentation of cervical and breast cancer, and it's pretty quick, in terms of the impact that you see when you screen early, So it's interventions like this that we will need. Communities are saying, look, we can see this is a problem, we'll get going, and they're getting going. What I'd like to see, hopefully going forward, is much more coordinated efforts by governments that are even cross-country, so multi-countries collaborating and having a cancer strategy that covers some of the common cancers, including breast and cervical cancer.
Dr. Pamba, appreciate your time. Independent health consultant from Roche Diagnostics as the African network leader, giving us that conversation on cancer awareness.